Okay, join quickly. So we are going to see the development of the tongue and thyroid now. Now see here, we have studied that the embryo makes head fold. This is an, if you're not understanding anything, please ask me, okay? Because embryology, few concepts we haven't started at pharyngeal arches and clefts and pouches development at, okay? In development of phase, I'll be teaching you that. But right now, what you will have to understand is, during the development, we have seen in the last section of embryology that there is folding of the embryo. So this is the head fold, what you are looking at, okay? Head fold. And you can see that on both the sides, this is all ectoderm, okay? Developing central nervous system, you can see. So ectoderm on both sides shows foldings, okay? These are the foldings which are called as pharyngeal arches, because this is the developing oral cavity. And on both sides of the oral cavity, since the oral cavity continues as pharynx, both sides of the oral cavity, we can see folds which are called as pharyngeal arches. We will discuss about this pharyngeal arches again later on. But right now, just understand these are pharyngeal arches on both sides of the head face region. Okay, so this is actually the neck region what you are looking at, and this is the heart and the limbs what you are seeing. So what is important is these are the arches. Now what we will do, pharyngeal arches, to understand this is the oral cavity. Inside the oral cavity, we'll have to go and see how the tongue is developed. So what we will do, we will take a section from here and enter inside and look at the floor of the oral cavity. This is the floor of the oral cavity. So we're looking from inside. So this is the floor of the oral cavity. Now see here, this is the first arch, second arch, third arch. So total how many arches are there? You have 6 arches, okay? Usually what happens? The 5th arch disappears. So total 6 arches are developed. 5th arch disappears, okay? So total only 5 are left. Now in that 5, you can see what you are looking at. You are looking from inside. Okay, so first arch is here, second arch is here, third is here, fourth is here. So when you look it from inside, this is the floor of the oral cavity. This is the anterior end. This is the posterior end. So this is the first arch, second arch, third arch, fourth is behind. Okay, so this is how you will see the floor of the oral cavity. Now when you look at the floor of the oral cavity, you can see that there are 2 elevations on the floor. From the first arch, okay, from the first arch, we will see 2 elevations. These are called as lingual swellings. What is it called as? Lingual swellings. Okay. Now see here, there is a small elevation here. From the second and third arch between, we will see that from the, actually this is the second arch. So from the second arch, you will see small elevation. This is called as tuberculum impar. What is it called as? Tuberculum impar. These are lingual swellings. This is called as tuberculum impar. Now what we'll do, we'll go to a diagrammatic representation. Okay, now see here, this is a diagrammatic representation. Okay, so here we can see from the first arch, we can see 2 lingual swellings. From the second arch onwards, we get tuberculum impar, but actually what happens is slowly it distributes from the second arch and enters into the first arch. Okay, so now what happens, totally these 3 swellings will be present in the first arch itself. Okay, so these 3 swellings join together. 2 lingual swellings and 1 tuberculum impar joins together and forms anterior 2/3 of the tongue. Okay, so this is the anterior 2/3 of the tongue. Now what happens to the second arch? Second arch is completely overlapped by growing of the third arch. You can see that from the third arch, this color, There is color difference. Okay, orange, blue, and light yellowish appearance, and the green. Okay. So see what happens to the second arch. It is completely overlapped by the third arch. Third arch overgrows on it. Okay. So that's why what happens, second arch is facial nerve. Okay. So cauda tympani is a branch of facial nerve. Since second arch is also there, but it is overlapped by the third arch, the cauda tympani branch of the facial nerve is the pre-traumatic branch of the second arch. That means what? Facial nerve gives one small branch which goes into the first arch. Okay. So that is nothing but cauda tympani. Second arch nerve is facial nerve. That means what I am trying to say, every arch has got its own nerve. Remember that. First arch nerve is mandibular nerve. Second arch is facial. Third is glossopharyngeal. Fourth is vagus nerve. Okay. So now what is happening? First arch, mandibular nerve. So lingual nerve is supplying general senses to the anterior 2/3 of the tongue. But what is happening from the second arch onwards, one small branch, pre-traumatic branch, it is called as, that is called as cauda tympani nerve, enters into the first arch. Okay. So that's why cauda tympani takes taste sensations from the anterior 2/3 of the tongue. Okay. Now second arch is completely overlapped by the third arch. What is the area coming from third arch? From the third and fourth, there is an elevation which is called as hypobranchial eminence. Okay, hypobranchial eminence, an elevation which is present on the under surface of the branchial arches. Okay, pharyngeal arches are also called as branchial arches. So in between we will see an elevation. This is called as hypobranchial elevation. Now hypobranchial elevation has got anterior part and the posterior part. Anterior part is present in the third arch. This anterior part enlarges and joins with the anterior 2/3 of the tongue. So this region forms the posterior 1/3 of the tongue. Okay. So what is the posterior 1/3 of the tongue development? It is coming from the ventral or the anterior aspect of the hypobranchial eminence. Okay. From the third pharyngeal arch. That's what you will have to write in the development of the tongue. Tongue is a very important question. You will get development, histology, gross all together. Okay. So you'll have to write development also, third arch. Development and nerve supply are linked. Remember that. Since third arch is forming posterior 1/3 of the tongue, the nerve of the posterior 1/3 of the tongue is glossopharyngeal. Why? Third arch is having, what is the nerve of the third arch? Glossopharyngeal. Okay. So this is the third arch. Then come to the fourth part, fourth arch onwards, what we are getting? Posterior part of hypobranchial eminence. So posterior part of the hypobranchial eminence gives rise to posterior most part of the tongue and epiglottis. That's why you will see that there is a mucosal covering which covers the tongue as well as epiglottis. Okay. So both parts are coming from the which arch? Fourth arch. That's why posterior most part of the tongue is supplied by what? Internal laryngeal branch of vagus nerve. Vagus nerve supplies this region because fourth arch nerve is internal laryngeal branch of the vagus. So these are the development. Once again, I'll repeat the development. What are anterior 2/3 is derived from 2 lingual swellings and 1 tuberculum impar. 3 lingual swellings. Okay. So they all join together to form anterior 2/3 of the tongue. Posterior 1/3 of the tongue is formed from the anterior portion of the hypobranchial eminence. Okay. And between these two, we have an sulcus terminalis. You can see that anterior 2/3 and posterior, since they are from different arches, we can see sulcus terminalis. So at this junction, we will see a small depression that is called as foramen cecum. From this foramen cecum, the thyroid develops. Okay. Posterior most part of the tongue as well as the epiglottis, it is derived from fourth pharyngeal arch. So related to that is a nerve supply. Okay, general senses, This is the mandibular nerve, that is the lingual branch of mandibular nerve is supplying it. Posterior 1/3 is supplied by glossopharyngeal, and taste sensations by chorda tympani branch of the facial nerve. Now see here, microglossia. We have studied microglossia, that means short tongue. Tongue is very small, but you can see that the frenulum is very close to the tip of the tongue and it is tightly adherent to the floor of the oral cavity. So what happens? The child has got the tongue tie, cannot speak properly, can have stuttering, all this speech disorders or problems. So sometimes we will see macroglossia, that is more longer tongue than the normal. Okay, this is a macroglossia. You can see that either the tongue is not developed at all, agenesis, aglossia or agenesis of the tongue, no tongue at all. Okay, now see here what happens to this. When we go to the thyroid, this is the floor of the oral cavity. Okay, this is the head fold. Okay, head fold. We are looking on the sides. So these are the pharyngeal arches, 1, 2, 3, 4. So this is the first arch and second arch. Now tongue is developing here. So between these two, there is a small depression that is called as foramen cecum. So from foramen cecum onwards, there is a long development of a tube-like structure that is called as thyroglossal duct. See here, slowly what is happening? The tongue is developing. Okay, foramen cecum is there. This is the anterior 2/3 and posterior 1/3 of the tongue. Between these two, foramen cecum is there. From foramen cecum, you can see long duct-like structure developing that is called as thyroglossal duct. Between the thyroid gland and the glossus means tongue. From the thyroglossal duct, on surrounding that, we will see the thyroid primordium, that is thyroid gland. You can see the thyroid tissue growing around it. Okay. Now slowly what is happening? This is the neck region of the embryo. Now the embryo grows and the neck becomes shorter. Okay, you can see that it is growing onto the surface of the heart. This is the surface of the heart and the hyoid bone is growing. So in front of the thyroid, in front of the hyoid bone, you can see that the long thyroglossal duct and thyroid gland is developing from there. So slowly what happens? Initially thyroglossal duct is patent. Okay, you can see that there is a cavity present between the thyroid gland and the tongue, oral cavity. Later on what happens? This will be completely closed. See here now, the thyroid came downwards and slowly the thyroglossal duct becomes completely closed. Okay, completely closed. Some cases what happens is, see here, this is thyroglossal duct completely closed, but within this you can see sometimes a cyst which might be existing. That means what? Thyroglossal duct is not completely closed. So you can see cysts there. Okay, these are called as thyroglossal cyst. Okay, sometimes the thyroglossal cyst can exist below the tongue, yeah, in front of the hyoid bone. Okay, anywhere during this pathway of the thyroglossal duct. Okay, so this is the thyroglossal ducts. Mostly thyroglossal ducts are benign. There will be no problem as such, but sometimes what happens? It can be converting into tumorous tissue. Okay, so see here, agenesis of the thyroglossal duct is not completely closed. So what happens is thyroglossal duct is open to the exterior. You can see that the thyroglossal duct is open to the exterior to the neck region. Now this is called as lingual thyroid. What is lingual thyroid? The thyroid gland is growing in the dorsal surface of the tongue itself. Here itself you can see that the thyroglossal duct did not grow down. Just here itself the thyroid starts growing. So this is called as lingual thyroid. So what happens? Sometimes small portion of thyroid gland can grow here itself. If it is larger, it can cause dysphagia, that is while swallowing you can have difficulty in swallowing. That can be easily identified. But sometimes what happens? The thyroid gland is smaller, cannot be identified. Some portion of the thyroid gland is in the neck. So in such cases, if there is any thyroid carcinoma, thyroid is removed, or thyroid tumor, thyroid is removed, but still the patient might have thyroid tumor because the small portion of thyroid is still present on the dorsal surface of the tongue. Okay, so that's why we'll have to evaluate the thyroid tissue is present anywhere in the neck or in the surface of the tongue as well. Okay, so that completes the development of the tongue and thyroid. So any questions till here? Any questions? Okay, the most important discussion